My name is Dr. Tony Gabriel. I'm a family physician working in Gander, and I'm also the president of the Newfoundland and Labrador Medical Association. With me today is Kevin Coady, Executive Director of the Alliance for Control of Tobacco, and Mary Lynn Pender, Manager of the Smokers Helpline. Also joining us today out here in the audience is Dr. Minnie Wassmeyer of the Newfoundland and Labrador Public Health Association, Stephen Tessier, Chair of the Heart and Stroke Foundation of Newfoundland and Labrador, Angela Noseworthy of the Canadian Cancer Society, and Peggy Earle, Executive Director of the Association of Registered Nurses of Newfoundland and Labrador. I would also like to acknowledge and welcome Liberal health critic Andrew Parsons. Thank you all for being here today. And thank you for the media for giving us this coverage of this very important topic. I want to begin by applauding the government of Newfoundland and Labrador for implementing a number of tobacco prevention initiatives in recent years, such as enforcement of public smoking bans and comprehensive awareness campaigns, all of which have helped reduce the number of smokers over the past decade. However, while we've been successful in deterring people from smoking, there has not been a significant decline in the province's smoking rate since 2003. It currently stands at about 20% of the population, or about 87,000 Newfoundlanders and Labradorians over the age of 15. If we want to see our smoking rate decline, we must focus our attention to help current smokers quit. Evidence clearly shows the most effective way to help smokers quit is by recommending a combination of interventions such as counseling, cessation medications, and nicotine replacement therapies, or NRTs. NRTs include nicotine gums, lozenges, patches, and inhalers, all of which are available over the counter. Tobacco cessation medications include such drugs as bupropion and varenicline and require a prescription from a physician. All smokers in the province, regardless of their socioeconomic circumstances, should have full access to these treatments to help them quit smoking. Unfortunately, access to these therapies is not universal for everyone. Low income, lack of education, and other socioeconomic factors are all barriers to accessing tobacco cessation aids. People who come from lower socioeconomic circumstances also have the highest smoking rates and are less likely to quit. Now, some may ask, if they can buy cigarettes, why can't they afford the cost of these cessation therapies? The answer is simple. They are addicted to nicotine. Nicotine addiction is no different than the addiction to any drug, and people will use whatever resources they have to feed it. As a society, we must begin to realign our perception of nicotine addiction as a serious chronic condition, not a lifestyle choice. We know that many smokers in the province make numerous quit attempts using the cold turkey method, but are unsuccessful. We need to help them break the cycle, just as we would provide methadone for someone with an opioid addiction. We can do this by making smoking cessation therapies available to low-income smokers who are ready to quit, but unable to afford it. When smokers use NRTs and cessation medications, they increase their odds of quitting by as much as threefold. As it stands, Newfoundland and Labrador and New Brunswick are the only provinces in Canada that does not offer some form of financial assistance for tobacco cessation therapies. Part of having a universal healthcare system means having equitable access to treatments that can improve quality of life. That's why today we are recommending that the government of Newfoundland and Labrador subsidize the cost of tobacco cessation medications for low-income residents as a benefit under the Newfoundland and Labrador Drug Prescription Program, better known as NLPDP. We are recommending that varenicline and bupropion be covered by NLPDP and distributed through pharmacies for smokers who have a prescription from a physician. Smokers who meet criteria of NLPDP coverage should also be eligible to receive a free supply of the NRTs in a method of their choice for up to 12 consecutive weeks in a single calendar year. The NLMA believes the Smokers Helpline would be an ideal organization to manage the distribution of NRTs to smokers. What we're proposing is that once NLPDP approves cessation therapy for a smoker, the Smokers Helpline care fax referral will be automatically sent to the Smokers Helpline, who will then follow up with the individual for ongoing proactive counseling. A Smokers Helpline counselor would then provide information on the benefits and limitations of each various type of NRT product and would assist the individual in choosing the product that best suits them. They would receive the NRT either by mail or at their local pharmacy, and once they've received proof of enrollment in the program. This strategy is based on current model used in British Columbia smoking cessation program. The NLMA worked closely with our partners in developing this strategy, and it has also been endorsed by other associations, including, well, the Alliance for Control of Tobacco, the Smokers Helpline, as you know, are here today, as well the Association of Registered Nurses of Newfoundland and Labrador, the Newfoundland and Labrador chapter of the Canadian Cancer Society, the Newfoundland and Labrador Public Health Association, the Heart and Stroke Foundation of Newfoundland and Labrador, and the Newfoundland and Labrador Lung Association. We believe the government can potentially subsidize the cost of this strategy by increasing tobacco sales taxes. This will have an added benefit, as evidence is clearly demonstrated that increasing tobacco sales tax is the most effective way to reduce the demand for tobacco products. In May, the Lung Association of New Brunswick conducted a representational survey of more than 1,000 Atlantic Canadians about their attitudes on smoking. The survey found that more than 70% of respondents from this province support an increase in government funding to help people quit smoking. The majority from this province also felt the government should fund tobacco cessation by raising tobacco taxes. Last year, our province collected approximately $135 million in revenue from tobacco sales tax. We believe it is time for the government to begin directing this money to fund cessation initiatives that will help people quit permanently. Subsidizing cessation therapies will also have a huge savings for the province's health system. The cost of tobacco cessation therapies compares favorably to the millions of dollars we spend each year treating smoke-related heart disease, diabetes, and the numerous respiratory illnesses that are all very closely linked to smoking. The cost of NRTs is also incurred over a very limited period of time as smokers attempt to quit, whereas the cost of smoking and the diseases it's related to persist over the entire smoker's health lifetime. As long as NRTs and tobacco cessation medications are not available through NLPDP, the retail cost of these therapies will remain prohibitive to people with the lowest incomes and the highest smoking rates. If we want to reduce our smoking rate, lessen the economic burdens of tobacco use, and prevent smoking-related illness in our province, we must eliminate barriers that people face in accessing affordable cessation treatments. I'll now turn it over to Kevin Coady of the Alliance for Control of Tobacco.
Thank you, Dr. Gabriel, and be assured I'm very pleased to be here today representing the Alliance for Control of Tobacco on such a very important health issue. ACT fully endorses the Newfoundland and Labrador Medical Association's recommendation that government subsidize the cost of tobacco cessation medications for low-income residents under its prescription drug program. This is a health move that is long overdue. In pre-budget consultations over the last number of years, ACT has made the case that it was time for government to revive its drug program to include tobacco cessation medications. In addition, ACT included this measure as a key action item in its 2009-2011 tobacco reduction strategy, and it is currently listed as a key action item in ACT's new tobacco reduction strategy, which will be released early in the new year. Unfortunately, to date, government has not responded favorably to ACT's repeated call for this measure to be implemented. ACT, like the Medical Association, believes that over the last number of years, government has taken the right steps in enacting legislation which made our restaurants, bars, and workplaces smoke-free, and in enacting legislation which protects children from secondhand smoke in cars. These measures are a clear indication that our government recognizes the need to prevent people from starting to smoke and protect individuals from the harms of secondhand smoke. While such prevention and protection measures cannot be and should never be abandoned, ACT strongly believes that now more than ever, is the time for everyone, including government and especially government, to focus on cessation measures. Tobacco use places a staggering toll on our province's economy, on our healthcare system, and above all, on our people. In 2009, 725 people in our province died from a smoking-related illness. That equates to an average of 14 people a week. 2 people each and every day. These people, this is a cry for help. And people need help with their addiction. Yes, it is an addiction, and every possible step should be taken to offer help to the 87,000 people in our province who are fighting this addiction. Where is a good place to start? Well, since we know smoking rates are generally higher amongst those who live in the lower income bracket, then it makes full sense that offering help through the provincial drug program is a good place to start. Hopefully, a start here will encourage others to support government efforts by rolling up their sleeves and working towards finding other ways to help everyone live a tobacco-free life. In a nutshell, then, should government accept and act on this recommendation? Yes, for all the reasons stated here today. Can government afford to do this? Yes. It is costing and will continue to cost government more not to do it. When should government do this? Immediately. Each day, people are dying from this addiction. Thank you.
Thank you, Kevin. I'd like to ask Mary Lynn Pender of the Smokers Helpline if she could say a few words.
Thank you, Dr. Gabriel. Every day at the Newfoundland and Labrador Lung Association Smokers Helpline, we hear from individuals from this province who are struggling to overcome tobacco addiction. The Smokers Helpline provides service to approximately 1,500 to 2,000 individual smokers each year. And with the Quit line now featured on cigarette packages as part of Health Canada's mandatory health warnings, the service's reach and utilization is increasing. So as Helpline counselors provide information and support, clients share their personal stories about their struggles in quitting. Many individuals desperately want to quit. However, coming up with $60 for the startup kit of Rent-A-Clean or $30 to $40 for the initial package of nicotine replacement therapy, they feel it's an insurmountable hurdle, and therefore they do not investigate these options further. When counselors recommend these effective therapies, we often hear clients express their frustration, and they say things like, but those products are just too expensive, or I wouldn't be able to afford them. Moving forward with this initiative will mean that low-income individuals will have access to the most effective treatment that is currently available to help people overcome tobacco addiction. Once the cost barrier is eliminated, then individuals can focus their energies on other aspects of their quit plan, such as planning healthier alternatives to managing cravings, accessing support, and planning positive rewards. The Smokers Helpline has a very successful care fax referral program, which was initially launched through the NLMA in 2004. The program has expanded over the years and is now used by a wide range of health professionals and community organizations to link smokers to our Quit line. Doctors continue to be very active in referring their patients through the fax referral program, and they are the #1 source of referrals to the helpline. The release of this paper here today is an extension of the NLMA and Smokers Helpline partnership. The evidence clearly shows that enhancing cessation initiatives through provision of free smoking cessation aids to those who need it most will maximize successful outcomes. And as an established service, With over 10 years of experience in providing programs, consultation, and leadership in the area of smoking cessation, the Lung Association Smokers Helpline is ideally positioned to distribute the NRT to individuals to supplement the counseling intervention. The Smokers Helpline certainly acknowledges the great support government has demonstrated for the quit line with increased investment over the past several years. But we now call upon the government of Newfoundland and Labrador to implement the initiative that we have put forward here today that will help many people take the next step to successfully overcome tobacco addiction. Thank you.
Thank you, Mary Lynn, and now we will take any questions you may have.
On the issue of raising tobacco taxes, this is an old issue, but at some point, is there always the concern if you raise them too high, the government says it runs into a problem with contraband and things like that? But what is an acceptable threshold for tobacco taxes?
And Kevin, you might be the best answer. You were talking about some numbers before we came in.
Yeah, the contraband issue is often used as an argument by governments, actually. But I think over the last couple of years we've discovered that actually the tobacco industry has been fudging the numbers and playing the contraband card to try and discourage government from raising taxes. All indications from all studies that have been done show that raising taxes is the best single move you can make to lower smoking rates. So I don't believe at any time we should hesitate and be worried about contraband or any other issue when we know that that's the fact, that taxes work.
So what kind of discussion have you had with government up until now about these ideas?
Well, we've, I know the I think all three of our associations have been lobbying government to encourage them to support this initiative. So we've sent all this information into government over the last number of months, and probably other information related over the last number of years to encourage them to look at the specifics when it comes to supporting this program. Ultimately, at the end of the day, government is going to be responsible for funding it. So government needs to do their work with regards to the costs and the setup. But we feel that this can be very successful, and there will be a cost associated, but the long-term cost savings will be huge, will be tremendous, and the healthcare system will benefit tremendously from it, and there will be many people that will benefit from it.
But would you say this is an idea that they're receptive to, they're skeptical about? I mean, well, what kind of response have you gotten from?
Well, I think the fact that the Department of Health and the government supports and funds the Smokers Helpline and the costs associated with it are significant. It shows a significant uptake by the government. Now we're basically asking to expand and give more tools, which we feel are very necessary and very effective tools to allow us to take this to a much greater level of effectiveness.
Is reluctant at the moment seems to take on any new expenses. You're running into a philosophy that says we have to cut back our budgets. So how do you overcome that?
We just keep at it doing things like this today, and are appreciative of all of you people here to listen and to be part of the discussion, because we have to make this a province-wide issue that everyone knows about, and we really feel that the upfront cost is not, it shouldn't be that much of an impediment to getting this through, because the long-term costs are huge. If you look at every smoker in the province, we don't expect every single smoker to avail of this program right off the bat. People need to be prepared for this. It's not just a matter of writing a prescription or giving them drugs and sending them out the door. There's a tremendous amount of support, counseling, preparedness that needs to be put in place for people before they go into this. I'm a family doctor, and there's not a day that goes by that I'm not talking to patients about their smoking and trying to encourage them, giving them tips, giving them education about what options are out there. And I see many people that are ready, and I see many that aren't. And you just keep working on them, and you're trying to encourage them. And it would be nice to have more tools to offer people who are ready. I would love to be able to go back to my office and say, look, I've got more things that I can do to help you here, because it's a hard work. When you see people who just had their leg amputated because of vascular disease still smoking, and it just shows what an addiction this is, and we need to help these people. Our healthcare system, that's what it's there for, to help people who need help.
Sorry if I'm missing the information. Did you have a sense of what the cost to the healthcare system is of smoking-related illness?
We can't say the specific cost, or the cost of. I can't give you a specific number on it. It has its fingers in every other disease. If you're a diabetic, you got issues when it comes to your health and all the complications. But you throw smoking on top of that, it's like putting gas on a fire. It's exponential. So the costs are tremendous. And if we could remove smoking from people, we would see immediately a huge improvement. Because when people smoke, the benefits to their health are immediate. There are some long-term risks that remain, but they get immediate benefit from quitting smoking. So the sooner we can get people to quit, we will see those benefits immediately with regards to respiratory illnesses especially, but in terms of risk of cancer, heart disease, and diabetes worsening.
And if
either of you smoke?
No.
Did either of you ever smoke?
I'm always asked that question, and I give the same answer all the time. I remember as a very young boy trying one behind the school that was across from my street, and I guess I was lucky. As I tried it, my father came around the corner. Little knock to the side of the head, and I never bothered it after. So that was the best knock I ever got, I think. Just to add to cost, when we did pre-budget consultations, the Alliance for Control of Tobacco suggested to government, and based on our numbers, that if you look at the number of smokers and the average number of cigarettes smoked being at 15 a day, if you do the math, by 1 cent a cigarette tax, right, 20 cents on a pack, you're looking at $4 million. This is not going to cost $4 million. So $4 million they could take in a tax increase by a cent a cigarette, based on 15 cigarettes, which is the average according to the Canadian Tobacco Use Monitoring Survey. So we've presented that case, but I guess there's a reluctance maybe to raise taxes, as we know, with government, and but they have to weigh this out, and everything that Dr. Gabriel has said here today, you know, what it's costing the province in the long run, what it's doing to our people. It's well worth this slight increase, and then put the money, there's a lot of money coming in taxes already. Let's get it back to the people who need to fight this addiction.
We can't forget the fact that there's a lot of money being spent to try and put ad campaigns out to encourage people to not smoke. And we've been very successful with this, with the younger generations especially. So there's already a significant investment. So we feel that we need to have some targeted investment to try and go after the hardliners, those that have been smoking for years, that are having a difficult time quitting, and they need that support because of their economic status is poor, and they realize that this is not helping them. But it's such a powerful addiction that we need to give them a helping hand, and we will see it in spades.
It looks here to me that for non-prescription options, there would just be a one-time supply. Is that correct, that something like Nicorette or some sort of over-the-counter method would just be a one-time opportunity as opposed to a more long-term prescribed?
I think what we would be looking at would be per year. We realize that people who try to quit smoking a lot of times have to try many times, and we can never give up on people because we know addictions are powerful and people will fall off the wagon. I've got many patients who've quit for so many months, and when I see them again, they're smoking again, and it doesn't mean that they're a lost cause. It just means they got to keep trying. If you don't keep trying, you'll never quit. So we figure if you have a yearly support of medications, either NRTs or the cessation treatments, that they would be able to use this allowance every year, and then if a new calendar year comes in and they're still smoking, they should be able to avail of it again.
What kind of timeline would you project for the prescription methods in terms of potentially how long could someone avail of the subsidized prescription medication if they are unsuccessful?
Well, again, I guess there's a certain supply for a 12-month period, and once that's up, they realistically would likely have to wait till the next 12 months in order to avail of it again. And that goes back to working with individuals, the Smokers Helpline, physicians, other healthcare providers who look after people, to basically help them to be ready. It's not, again, a matter of giving them a prescription or a pack of gum or whatever and saying, go on, good luck. It's a matter of helping them to plan. A person needs to be of the right mindset to quit, and you want to really see it, or they need to see it themselves as to how they're going to get through this. They need to recognize the pitfalls in the way and things that may make them more likely to go back to smoking. So we want to put a concerted effort into this, and we know that these aids help, and they result in people quitting smoking. So we want to make it available to them. Again, realizing that it can't be a cost that's forever. They can't be on a drug day in, day out for 365 days a year. There's got to be certain limits on that, because we have to have some. We have to go to government and say, look, this is going to be cost effective. So we figure if we give them an amount of therapy per calendar year, and if they need it next year, hopefully they won't. Hopefully they'll quit and they'll remain quit. But it will be something that will be there for them if they need it.
And
you mentioned the cost of, I'm sorry.
oh, generally it's a 12-week course of treatment for those different therapies, right? Yeah.
And what is the cost of that? You mentioned it earlier. I just want to make sure I understand the numbers correctly.
Yes, varenicline costs about $120 per month, and bupropion costs about $70 per month. Nicotine replacement therapy, the cost varies depending on what product you're going with. But as I mentioned, if a person was going to the store to pick it up, they're probably looking at $30 to $40 for that initial startup pack, which will do 1 to 2 weeks.
Okay, so multiply that by 6, I guess. You said 12 consecutive weeks, so.
Yeah, and in the paper, the costs are mentioned there.
So you see that. Okay.
So the cost is not insignificant, but at the same time, it's based on scientific evidence as to how long these therapies should be used over in a planned assault on the smoking habit, so that we can have effectiveness from it. The smoking cessation aids I have more familiarity with, because they're different. They're not replacing, the nicotine is not coming from your cigarette from another source, such as the inhalers and the gums and the patches. The cessation aids, which I'm more familiar with, are basically trying to eliminate nicotine from your system, in terms of they block the nicotine effects, or they have impact on your ability, your willpower, so that you can quit. So they basically are supporting your giving up the nicotine as opposed to replacing it. So they are used separately. You wouldn't use both of these at the same time. You wouldn't use a nicotine gum versus one of the cessation aids, the varenicline and the bupropion. They would be used one or the other. So there is a difference in that regard.
And just to follow, on page 5 there, the costs of the various
Yes.
are outlined, what it would cost for the treatment.
Well, that's great. I appreciate, again, everybody coming in today, and if you have any further questions that come out of our discussion today and you would like to ask any of us, we're all very open to promoting discussion on this topic. Thank you again.
Thanks.